welcome to all on this episode of Iron Talk Show with the legends of neurology. Neuroscience is by far the most exciting branch of science because the brain is one of the most fascinating objects in the universe. Every human brain is different, and brain makes each human unique and defines who he or she is, in the words of Stanley Prusner. Hello, I'm Dr. Soumyadarshan Naik, and today on this episode, we are going to meet one of the stalwarts of neurology in Eastern India, hailing from one of the most beautiful states of our country, Assam. Born in one of the most remote villages on the banks of Brahmaputra, his story is one of struggle, perseverance, and dedication, which has led him from Ames to Queen Square, London, and then back to his roots in Guwahati Medical College, and later catapulted him to being one of the most sought after neurologists in northeastern India. Ladies and gentlemen, I am talking about none other than Dr. Narayan Upadhyaya, an eminent neurologist, philanthropist, clinician, and a great human being, one which has led him to be one of the demigods in Assam and the neighboring states. I welcome Dr. Upadhyay to the show. Hello, sir.
Thank
Welcome
you.
to the show.
Thank you very much. Welcome.
Sir,
Yeah.
at the outset, I would like to highlight a little bit about you, and after that, we go on to hear a lot about you. So, about Dr. Upadhyay, he was born in Dibrugarh, Assam on 1st February 1951. Sir, at the outset, I would like to ask you, how was your childhood days in Assam?
Childhood days in Assam for me was a mix of poverty, but at the same time full of thrills. Poverty in the sense that economically we're devastated because of the flood in Dibrugarh after the earthquake in 1950. 15th August, there was a great earthquake that is still remembered as one of the greatest earthquakes, which totally changed the demography of Dibrugarh, especially the river just raised up and it flooded both the banks. Then we were from Dibrugarh, we were relocated to Dibrugarh. And as you know, Dibrugarh at that time was the oil city at one area, and the forest village just next to it. Saikhoa Dibrugarh Reserve is the part of it, and we were there. That was a dense forest when we were actually relocated there. We had to cut the trees and then make our dwelling houses, then do the plantations because we became agriculturists. While in Dibrugarh, in Romaria village, which is still eroding, we are better off because we had cattle. My father was a Pandit priest, and we had a Gurukul system in our school. We used to teach, father used to teach the students in Sanskrit and astrology. So actually, it was something like a heaven there. And suddenly, we migrated to Digboy, and in that Digboy forest village, very located, and we had a very hard time there. But the beauty was that when we were in Digboy forest village, we could see the animals from the very close quarter. We saw tigers, we saw the foxes, we saw the pack of elephants. Then the Hulux monkey. Hulux monkeys are very dark in color, but then they make constant sounds from the forest. So they are called Huluk monkeys. And even so, those we enjoyed. Of course, we didn't have any catastrophe because these animals sometimes, especially the tigers and jackals, used to take away our the cows and goats. But then we were set. We didn't have much a problem, and like that we started our life. And my school was primary school was about a kilometer away. From that village, remember, we were three students to the school, not kilometer, it's about a mile away. And we used to walk through the dense forest. There was a road in between. So always we were afraid that something should not happen. And like that, we started our schooling. Then from there, yeah, you want to ask anything?
No, no, sir.
Ah,
It was just listening to you is wonderful. It's just like Mowgli. What we say, Mowgli. You were means
yeah,
having a life in the beginning, just like Mowgli, enjoying tigers, monkeys, buffaloes,
yeah,
elephants. So it was just wonderful. So
yeah.
how did you means your childhood was pruned by two very beautiful persons in your life, your father and mother. So, how did they guide you? How did they actually train you, sir?
I don't know. My father was not English trained. He was just a Sanskrit Pandit. He was an astrologer also. And astrologer did astronomy. He just taught me to look at the sky and find the pole star. At the age of probably 5 or 6, I used to look at the sky and then he told, I don't know whether that was the pole star or not, but he told this is pole star in the northern horizon. And that way I started. Then the Sanskrit recitation was, I think, still reverberating in my mind. My mother used to read Gita, Bhagavad, and Purana, and all the 700 sloka Bhagavad Gita was actually she could memorize even till our date. I think, couple of years back. So she was such an outstanding lady. And my father had a very, I'll say, a special quality that whenever he used to do anything, he would ask me. I was a small boy. Suppose buying a bicycle, he'll say whether it is Hercules or rally cycle, he will buy of his own, but then he take the, at least my opinion, used to take along with him to the meetings. And when in the meeting we were sitting and big people are on the dais, he used to ask me, who is the greatest man sitting on the dais? Because there I could see somebody making a face like this, very serious face. Other had a very just a light sort of a behavior. So I could not make out which is the real person I should be like in my coming days. And then he used to ask me, so who you like to follow, what you like to be. And still I do not have the answer, but I now know that one who is very simple in his speech, in his action, in his appearance, in his behavior, I think he's the most ideal man who should try to be like that because the personality was developing at that time. He enthused me, he encouraged me to do to find this suitable suppose a personality type I like to adopt.
He was actually giving you a lot of options, sir, to show you the different types of personality and whom you'd like to follow. So
Exactly.
that was so
Exactly.
wonderful, sir. And as I gather, you are also a very meritorious student. You stood ninth
Oh,
in the Dibrugarh University.
that I cannot claim. But anyway, I was good. I will say that because in my primary school, I stood first. In my secondaries, from class 4 to class 10 was the secondary school. There were three students who sometimes just crossed about to another. I became first sometimes second or third. And amongst us three, the whole thing rotated. But then one thing I learned from my very early days from my mother, I think that must be mentioned. Whenever I asked the mother, there's some subject is very tough, she used to say, memorize it. Because she was expert in memorizing, and she asked me to do that. Suppose if I tell that this subject is little difficult, she would say, memorize the whole book. So I don't know how whether that is now psychologically true or not, but then still that works because in the early days, memorization was quite easy. We didn't understand anything. But then later on, now I understand all those slokas and the Sanskrit citations, what they mean. And the other thing was my mother actually knew how to help me in the young age to find a friend, because children do not know how to select their friend. And she used to ask me, what's the best in handwriting in your class? And she will ask, who is best in English? Because at that time, English speaking was a sort of a fashion. If one can speak English correctly and in a decent way, probably he is regarded as, yes, he's a learned man. And the other was, who was good in mathematics? Who is good in science? So I used to tell the name so and so is good. And she will simply say, call them to our house. And on the holidays, I used to just call them. The whole day we'll be playing, because I know I told you that this is a area which is far from the town, and they will enjoy. So the whole day we'll be fishing, we'll be just going through the forest and then collecting the fruits. And in the evening, she did another very interesting thing. She would suppose keep them some fruits and vegetables and some household products and take it in a bag and then give to them and say that give your parents that the small gift from your friend. And from the next day, I found that those boys who were good in English didn't care to share with me, became friends. And like that, she actually chose friends for me without knowing that this is the way. Probably she knew, but then I think that probably she didn't, unknowingly she did. But whatever way she did a very good thing. And I found best of the friends in my life. You believe me, Somadarshan, that in my life, my greatest treasure are my friends, besides teachers. And she asked me another very important thing to do, be good with the teacher. If we can maintain a very respectful relation with teacher, we don't antagonize much. Asking question is a different thing, but then we should not have a direct antagonism to teachers, and the teacher will pour everything they have upon you. So that was how I spent my childhood days, and still it is in my mind.
Wonderful, sir. Actually, she was your not only your closest friend, but she chose friends for you, and
Yeah,
she guided you, sir.
she guided me.
And I also gather, sir, during your early days in Assam when you were training in DM medicine, in MD medicine. So those were also very means difficult days for you. And how was the days in when you are training for MD medicine?
Actually, I have to go back to MBBS, because when I joined my MBBS course, I didn't have any financial resource. I applied for the scholarship. Right? I got the merit cum means scholarship, right? But that was too small a sum, and small a sum. And to apply for that, the income was to be written there. So, what is the monthly income or annual income? So I told my father. I asked my father, how much should I write? He told, you know, because I am not a student and you are the student and you know all the things. So he just made me to believe that I know. So I wrote 1,000 rupees a year, because that time there was no verification. Nothing. Then when I applied for MBBS course, later on before the selection was done, so there was a rumor that those who have very low income, they will not be selected. I told my father that you just left on me, you didn't give any comment, and I wrote a small sum. So in 1,000 rupees, how one can have the admission? But then later on, that criteria was not taken. Only on merit basis only I got admitted, and I passed with scholarships. I continued the course, and ultimately I passed it with a good position. I will say, being from a background like that, I stood 9th in the MBBS. So that was, I think, my good success also. Then I went for MD. And in MD examination, the interview, I also did well. And then in the first sense, I got admission to MD in Guwahati Medical College. So during that time, there were some very illustrious teachers. One was Professor Lindu, who happened to be, because that time I'm just seeing how great people are and how they are great, in what qualification they are great. So somewhere MRCP, and the surgeons were FRCS, because that time most of the people who were in the faculty were trained in UK. Then after that came another batch who were trained in other states of the country, like for the gynecology, MD gynecology was from Lucknow, and some from Calcutta, because that time postgraduate courses were not there in Assam. So those teachers, they taught me. And Professor Lingdo, O Lingdo from Ceylon, he was the honorary physician to the President of India. Then I thought, wow, how great a person he will be. Because he's a physician to the President of India, the highest chair. So anyway, I feel very lucky. And then those are good teachers. They taught us the basics of medicine. Because the basics of medicine means how to examine a patient, how to deal with the patient. I think the better part is before examination, how to approach the patient and have a cordiality with them, a good relation with them, so that they can tell everything. They can just speak out. So all the problems, confide all the problems to you. Because I find that often MBBS students, they complain that whenever they come for the evening round, the patient do not give the history. And among them, they talk mosquitoes that have come to bite us. So now, when I had the another way of dealing with them, I think it was a very sort of a good relation. And even afterwards, those people became my friends, and many are now friends till now. That was how. And the MD I completed. And when I completed the MD, then I thought, what should I do? Because in the meantime, I got married. See, my
Oh,
marriage was just when I joined the MD. The marriage was fixed beforehand because the admission came later on. So I had to marry. I married. Then the pressure came from my counterpart that now you have to join service, because only doing MD and then getting a degree is not enough. You have to just take care of me also. Then I applied for this. The new notification came for the Register of Psychiatry. I applied for that, and I got in the APSC, Assam Public Service Commission. I got actually the first nomination, and I became registered. So in service, I was a student initially. Later on, I became in service student, and I completed the MD course in the first chance and became. And then later on, I joined Department of Psychiatry. And joining psychiatry and later on becoming neurologist was a great asset for me, because every neurologist should have a good knowledge of psychiatry. Good knowledge of psychiatry. The reverse way, I would say that every psychiatrist should have some knowledge of neurology. Because without the knowledge of neurology, the base, because after all, it is the brain which produces the psychological symptoms, right? We call psychiatric symptoms. You must have the knowledge of neurology. Later on, this was used actually useful for me, that whenever the psychiatrist invited me, when I became the registrar of neurology, later on assistant professor, in the seminars, the psychiatrist used to invite me to take classes, do the clinical exams. I felt very happy. So later on, of course, I came to medicine, then to neurology, and this way I just changed. Yeah. So
wonderful,
maybe
sir. So, having a knowledge of psychiatry, and we hear the term neuropsychiatrist, but actually today I'm seeing a person who has both degrees, psychiatry and neurology.
not at
So,
all,
how
not
did
at all. See, the
so how did you reach?
neuropsychiatrists, sometimes I have got little difficulty in digesting the term. They have done psychiatry, but later on they write neuropsychiatrist. How that
Right,
becomes
sir.
neuropsychiatrist, I don't know. Of course, it is not an assault to them, right, or
Sir.
denigrating them. But they should have written psychiatrist only. That would have been good enough,
Yes, sir. So that
right?
is what we also think. So they
You
should make
also
only
think,
psychiatry.
right?
Sir.
But then for me,
Wonderful.
it was really wonderful, because the basics I knew: what psychiatry, what the mind is, how the mind works, what is anxiety, what is depression, what is sort of a delusion, hallucination, all those terms. Now it comes in the confusional state whenever we examine the patient, right? All those symptoms we find, and we know how much it is organic and how much it is non-organic. And they say that psychiatry is a non-organic, but now they have come to again to another way that even it can be organic psychiatry, organic symptoms also can produce psychiatric manifestations. So that way I
Right,
was really benefiting.
sir. Sir, how was your journey to AIMS? How did you get DM neurology names? So please guide, because lot of young neurologists would like to hear from the remote places in Assam. You were catapulted to one of the most prestigious institutes in the country, and later on to Queen Square, London, where you did your fellowship in neurology. So
Is
let
the
us hear
yeah,
about it.
yeah, yeah. It is the spirit inside, nothing more. Because you see, the way I started my career, I didn't know what is the next step, what I will be, what I will be doing, right? So like that, I did my MBBS. I didn't know that I will do MD. I did my MD. Then I realized that rather than doing another 2 years in psychiatry, that time it was 2 years psychiatry MD, rather I'll go for DM neurology. I should repeat the same MD course. So I thought, being in psychiatry, I thought even my teachers used to tell me, you decide whether you want to remain in psychiatry, then do DM psychiatry, MD psychiatry, or if you want to go right now. So actually, she was pushing also. My head of department was a lady. And then I felt that she did the right thing because she thought for my career. So when I was in psychiatry, I thought that I will do neurology. And that was long time back in 1977 when nobody from Assam has gone for or even thought of doing MD, DM neurology. So that time I applied, and I applied to the vacancy was in the application. The advertisement came from the Nimans, Bangalore, and I appeared the interview. But then I could not get it for a simple reason that my 3 year service was not completed, and I didn't get the deputation. If I do not complete 3 years, I'll not get deputation, and I cannot study on my own. So for that, I had to forego that. And actually, things went past another 5, 7 years, and later on, only I did my the MD sector. Anyway, so when I was applying for the DM neurology course, I was transferred to Silchar. You see, I was not in Dibrugarh also. And from Silchar, every year I put my application to the government. They will not give any reply. And ultimately, I got frustrated because Dr. Ajay Mahanta, she did MD. She was the first MD from, I think her photograph is here, you can show.
Yes.
She did the first MD, DM from DM neurology from AIMS. And that was 1981, 82, like 81, yeah. She did that DM. Then after that, Dr. Nomal Varaje from the GNRC Guwahati. I found that Dr. Ajay Mahanta was 1 year senior to me. Nomal Vara was about 4 years. So when he had done, then I thought, why I should remain behind? I must try. Then from Silchar, I put an application. Then I went for interview. Dr. Bora helped me because I stayed with him, and then it was a good thing that he helped during the formative period of my life. And I appeared, and in the first chance, I got admission to DM neurology. I
Right.
could crack it.
We'll hear a little bit about how you moved to Queen Square, London, and then I'll show some nice pictures of your different teachers, your icons,
You
and
won't ask me what I felt, how I did in DM neurology training.
absolutely, sir. Who are your teachers? Who are your teachers? And how
That
did you?
that was a totally alien land. Because still I entered the totally alien land. I didn't know what neurology is. Because the first time I have seen a DM was in 1974 during my the MD course. A fellow IP Sukumar, still I remember the name, a dark-colored fellow. He came from CMC Vellore.
Right.
And then he gave a lecture on some cardiological problem. Then I thought, how knowledgeable he will be, DM, right? So he was like a god in my mind. So I thought DM is something which I must somehow I have. So for that, actually, I went to AIMS and I got the admission. And there, when I got the admission, when I started my senior residency, it was the most difficult time of my life. Most difficult time of life because I didn't know actually how to do the routine examinations, how to see the cases, how to give opinion, because senior resident is regarded as one of the very knowledgeable fellow. You have to give your comment and opinion. But somehow, with the help of senior friends and teachers, I could gradually take up the things. Then the difficult thing came after 3 months when I was posted in a neurophysiology, where you have to do easy. I have not seen the easy machine till then. right? PMZ, nerve conduction, and evoked potentials. So I had much difficulty because at night, sometimes I used to have the terror dreams, and somehow I could,
Every DM had during those days. And
yeah.
sir, how was your stint? Who were your teachers? Who were your favorite teachers, and whom you idolized during your DM neurology days?
I think not one, many, but few names I must mention. Professor G.K. Ahuja. Actually, very honestly, I will say I was very much afraid of him, very much afraid. Even I had another friend who used to say that, okay, let us complete this. Then we'll talk to him that you were so harsh to us. But then now I think he was the kindest man. Dr. G.K. Ahuja, Kulsan Kumar Ahuja. His interest was in myasthenia. His interest was in these movement disorders. Besides the common neurology, he used to teach us. When he took the rounds, actually, we learned much from him. The other thing I learned from Dr. G.K. Ahuja was like a coconut, very tough from outside. During the teaching, he was very tough person. During the round, he was tough. But whenever he invited us to his house, I found his daughters climbing upon his back and then just snatching his hair. I thought, Are this same tiger at home, he becomes just ordinary father, just like my father. Then I learned that yes, he is like a coconut, only tough from outside. Then another was a fatherly person, MC Maheshwari. Right? Those were the two teachers. And another was Amitabh Burma. Right? He was a very glamorous man. But then these two were my real teachers. Then side by side were the neurosurgery because at that time, there were only 24 or 26 beds in neurology, right? 13 to 1 Dr. Ahuja, 13 to Dr. Maheshwari. And you see, in the OPD and in the emergency, a lot of cases came. So we had problems in decide which we admit and which not. Once I failed, I called a person who was from Assam, and then I told him that in the next day I'll admit you. And next day I found that there are more serious cases than him, and I could not actually admit. So I went to Dr. Auza to take the opinion. Sir, what should I do? Whether I will, because I have given commitment to him that I will admit, and he is from my place, so I have to do my service also by helping him. But then I could not because there is another serious person. Then he told me, "Tum ek buddhu hai, kuch nahi janta." Then I kept mum because I didn't reply, and I realized that yes, hum kuch nahi janta. He told, "You are senior resident, and take the case to casualty. Admit through casualty. The whole All India Institute beds are yours. You find bed anywhere. And the day after or day next to that, you regularize to your word. Because if you want to help somebody, you can go out of the way." So that was the great teaching. If you really want to help somebody, you can go out of the way. So I took the patient to casualty. The regular one through OPD, I admitted. The other one through casualty, I got admitted. And I learned a great lesson that if you want to help somebody, being in medicine, right, there are so many ways, alternative ways. Nobody will blame you. So that was Dr. Ahuja. And Dr. Maheshwari was a fatherly man. And Professor P.N. Tandon, I tell you, he was a shame of a person because the brilliance knew no bounds. And the way he talked to people was something really it is to be copied from him, to be learned from him. Right? He would not hurt anybody. And there were others who were little tough. Right? I found Dr. Benugopal. He used to always scold me. "तुम कुछ नहीं जानता, तुमने कुछ नहीं सीखा यहाँ आकर के." And I found that he used to sleep in the near the what is called your surgery ward, right, at night whenever he operated any serious patient, the ICU itself. So he was such a dedicated man. Right? So those were the persons whom I still respect, and then I keep in my heart. They are still alive. They are having a long life. Let God give them another long life. Doctor, regarding about Dr. P. N. Tandon, I remember one very important, before I forget, I must tell you that he told a very nice thing to me. And then that still I remember, he told in one of the seminars, see, basic science has advanced so far, but then the applied science is far behind. Then he gave an example. The MRI technology was invented before 1950s, but the MRI application in imaging came in 80s only. So the basic science, when they are not wedded to the applied science as early as possible, probably will be lagging. There will be a difference between these two. And still I remember, yes. Then another interesting thing coming to my mind about Professor P. N. Tandon. He told our neurosurgeons, most of our neurosurgeons are like carpenters. That means if there is any problem, they will open the skull and find out what the problem is. And later on, if they find, remove or do the needful, and if not, just close it. So they are like carpenters. He told every neurosurgeon is a neurophysician first, he is a clinician first. He has to decide upon by clinical examination or now with the help of investigation what the problem is. You have to identify the problem. Then only you should go for the next step, the surgical intervention. I don't know whether that was an aspersion to the neurosurgeons, to his colleagues, or his real feeling inside. So there are many things I can just bring to my mind about those great people.
Wonderful, sir. Sir, after DM, you moved to Queen Square, London for your fellowship. So, how was your stint at Queen Square, London? And whom did you meet? We want to hear about all those wonderful teachers you met
But
there.
actually, I did in 85 MD, DM neurology. Then after that, I went to my jobs. And at that time, I was associate professor in neurology. A thought came to my mind, why not go for higher training, at least abroad? Because in India, I have gone to Just Look and the other institutes for Just Look. I went for neurophysiology training because Dr. Wadia's wife was in charge of the electrophysiology lab there. So, I had a stint for about 15 days there, some workshops I attended. Then after that, I thought, no, I should go out. I should at least have some experience. And at that time, the thought just started working inside me that how I can do it. Because going outside, going abroad is not so easy. So I applied for these scholarships. And luckily, I got the WHO fellowship. When I got WHO fellowship, then I thought where to go, because with that fellowship, you can go to any country, so any institute. So that time, gentlemen, colleagues from Calcutta, they came to my country, and one of them is Chakravarti. Meeting in Calcutta, the other was Kalyan Bhattacharya. Ammar Chakravarti, he told, "अरे भाई, कल तुम्हारा वो बॉस आ रहे हैं यहाँ, को शाम के उनसे मिलाऊंगा. I'll just introduce you to him." And Professor C.D. Marsden was there. He introduced me. And I told that I have got WHO fellowship. I want to join your institute under your tutelage, right? Under your guidance. So can I be fortunate enough to have that? He just smiled. Give me your card. I gave him your card, right? I didn't apply otherwise. Then he went back and sent a fax message. I got, then I left. And my greatest advantage was that at that time, Professor C.D. Marsden was regarded as God, demigod, right? He was so much a respected person. And as I was his pupil, because under his actual recommendation, I got the not sponsorship, in facility. So with him, Professor Quinn, and Kailas Bhatia was very young and energetic man. Even now he is very young and very handsome man. He was there with him. He was just a registrar at the time. And we are like friends. So we used to exchange our thoughts and ideas, and then he used to help me a lot. So I got help from everybody. And I remember once there was a case discussion about tubercular meningitis or some, chronic meningitis case. And he asked me, "Hey, this fellow from India, He knows more about tuberculosis, neurotuberculosis than anybody of us. Yes, you tell me your experience. So I think that simple word that I got from Professor C.D. Merchant was so encouraging. Still, I remember. What I told, I don't know, but then encouraged me was really great. So
So,
yeah,
so this is one of the photographs of you with Professor Fan and Dr. Marsden and the wonderful Dr. Kailash Bhatia, sir.
yeah.
So,
Actually, what happened? I don't remember which conference exactly it was. Right? They came, and then somehow I had a hello with them, or a respectful sort of a interaction with them, and we found that we are going to. It was in Bhubaneswar only, right?
so
Maybe it was a NSI. It was probably NSI. It was NSI, and then after that they went for the Sun Temple darshan, right? And I, along with my wife, we also went there. So there we met and had photographs. So that was a very good time, because when you find such people, and even to be in their shadow also, standing in their shadow also, sometimes it is so illuminating to you.
yes, sir.
Because I believe that knowledge is transferred not through words only. Knowledge is transferred not simply through these didactic lectures. Even being in proximity to people who are knowledgeable, you will learn. Just like from one magnet to the soft iron, magnetism is transferred, right? Without being in a direct physical contact. Being
Right.
in proximity. So that I believe that even their proximity had helped me a lot. Because how they stand, how they walk, how they talk, how they speak, everything had an actually beneficial influence upon me.
Sir, I'm sharing one or two more photographs with some of the legends. Sir, how was your association with Dr. Mathai? You came in close association with Professor Mathai, KV Mathai, sir. How was your association with him?
Professor Mathai was regarded as demigod of CMC Vellore. Because at that time, I am talking about 1977 and before. At that time, we had known about Dr. Mathai. People from Assam used to go to CMC Vellore for neurological problems. And the other was Dr. Bhavesh Kakoti, the first neurosurgeon of Assam, was trained at CMC Vellore. And he came back in 1977. And we just heard later on Dr. Mathai came to Assam to deliver some lecture to his student's place, Dr. Bhavesh Kakoti's place. He came here. And that time we saw God with our own eyes. And from that time only we were impressed with him. And he was such a simple man with a dedication. You see, Professor P.N. Tandon or the AIMS group and the CMC Vellore group has a great sort of a influence on the development of the neurosciences in Northeast India. I must admit that. Because if AIMS group had not trained Dr. Ajay Mahanta, Dr. Narayan Upadhyaya, Dr. Nomal Bara, well, in early 80s, probably would have been much far behind now. And if Professor Mathai has not trained Bhavesh Kakati and Dr. Zakir Hussain later on, and then he came down to Assam and stayed with us to develop this neuroscience, I think the Assam would have been far behind, because everything goes here very slowly. Assam is a land of lahe lahe, it is all. So Dr. Mathai actually was a demigod, and people will think like that. Then later on, Dr. Mathai came to Guwahati after his retirement and stayed with Dr. Numal Bara to develop his institute. Dr. Numal Bara definitely will actually admit that it is because of Dr. Mathai that he got the popularity and name and fame for his institute and for himself. Dr. Mathai stayed for a long time. Then after that, Dr. Mathai came to Dibrugarh. He stayed here, I think, for about 3 to 4 years. At that time, he used to come, even I used to invite him to my residence also, he used to come. And he told so many stories of his life. And his stories are very interesting. Dr. Mathai, because here we saw a man who starts his clinic at 8 in the morning, was as cool and I'll say, comfortable as 8 or 9 in the evening. Even at night, whenever we go to him to meet him, sir, have you finished? He's like, yes, I am finishing. And he was saying cool and saying the last patient with the same coolness. That was Dr. Mathai. And Dr. Mathai had certain very important qualities which he used to put to us. He told that every doctor should be obsessive. He should have obsession in his mind. He should also be neurotic, but without being compulsive. Right?
Right, sir.
So that obsession will make you successful. He told that you must have a sense of belonging or sense of involvement in your activities. So that was Dr. Mathai, and I still regard him as a god. And he told that for the Northeast, I have got a very soft corner, and I have got soft corners for Nepal and Bhutan, because the kings of Nepal or the royal family of Nepal, along with other people also, other persons also, they used to visit CMC Vellore for the treatment of neurological diseases. And from Bhutan also, same. So he was sometimes invited there. So we had long talks whenever he was in my house, and we used to just exchange those thoughts and his experiences. And he was really a great man for me. I can never forget him and his contribution to us, because he helped me to start the Neuro Club Dibrugarh. He told that a doctor in itself is not enough. He has to be in the group, because only as a group, when you function, you become strong and you can do many things. So he took us to the actually group activities, to do many social activities and even research studies. He actually initiated us to the formation of the Neuro Club, or which he proposed my name to be the chairman. I don't know, he was advisor, and the first Neuro Club was initiated in his presence.
So you were also the president of the
Neuro Club Dibrugarh.
Yeah, Neuro. So Dr. Shyamal Sen, Dr. Ambar Chakravarti, they were also very close to you. Professor B.S. Das. We'll share some photographs where you are seen with them.
This is great, great photo, right?
Some of
Because
the great,
as I told you, I respected the teachers from my heart, and somehow they attracted me to their proximity. So whenever there is a vacancy, they will say, "Upadhyaya, aao mere saath baitho." Right? So I don't know what was the reason for that. They loved me, they liked me, or somehow I liked them so much that they could not resist. So that proximity was brought. And in 1995, when the Neuro Conference was held of Association of Neuroscientists of East in India, the 9th conference, annual conference, Dr. Samuelson also came, and he met my mother. I told you about my mother. And he was so influenced. Whenever we met later on, he say, Mataji ko mera namaskar kahiye. Because I learned that even Professor Samuelson used to do puja rituals and those shloka parts for complete 1 hour before coming to for his professional work. So he was such a pious and devoted man. And later on, he suffered stroke. At the time from Dibrugarh, I went just to see him, to pay my homage. And even till the last days, he was actually in communication with me. That was Professor Syamal Sen.
So some more photographs.
Yeah. The Professor Bhagwati, Professor A.K. Banerjee. See, all are smiling. I am in the company. It is not me only smiling. Yeah, Professor B.S. Das. Professor B.S. Das and right. Professor Sarala Das. Actually, they have come to my house. See,
right.
Yeah, my son, my wife were there.
Sir.
Right?
So this was a deemed convention, I presume.
Yeah. This is Dibrugarh University convention, because I was for some time actually member of the university court. And later on, I am the member of the academic council of Dibrugarh University. So this is the photograph taken during one of the convocations. This is the convocation dress I am proud of that.
So we'll share some photographs with your colleagues. sir.
Yeah, this
Can
was
you
my
highlight
first.
your stint in
Yeah,
Guwahati
go ahead.
Medical College and also Assam Medical College, Dibrugarh? How was your journey there?
Pardon, sir?
Sir, your stint in Guwahati Medical College and Assam Medical College, Dibrugarh.
Ah, yeah, Guwahati Medical College, I stayed for a short period of time, maybe few months only after my DM course in neurology. Because
Right,
from Dibrugarh, there was a great demand that neurology should be started in Dibrugarh also, because Dr. Ajay Mahanta and Ashok Kayal has already joined Guwahati Medical College. So I was transferred to Dibrugarh. And when I came to Dibrugarh, I think that is another very exciting experience for me. When I came to Dibrugarh, you see,
you
I
are the
didn't.
founder professor, sir.
Pardon, sir? Pardon?
You are the founder professor
Yeah,
of
later on, I
Dibrugarh.
became founder neurologist, you can say. I started neurology from the scratch. It was just a unit of neurology under Department of Medicine. But I
Yeah,
was so lucky that even the unit was attached to the professor and head of medicine. So Professor H.P. Barua was a legendary professor was there, and he liked me right from the Guwahati days when he was my teacher in MD. Just when I came here, he found my disciple is coming, so you will be with me. So I used to help in seeing the medicine cases. At the same time, I did my take care of my neurology patients in his ward. So I was privileged to have that. And remember, another very interesting is when I joined the medical college, I didn't have a place to stay because I am a family holder. My wife, my children are there. So I asked principal for an accommodation. He told there is no accommodation. You have just joined. How you can get on the same day? But in 2 or 3 days' time, I found that the staff of the Assam Medical College, especially the administrative staff, they approached the principal and told that there is one quarter lying vacant and that has to be renovated. Dr. Upadhyaya has agreed that he will do his renovation work, sir. It can be just allotted to him. And he called me. Are you agreeing to renovate? I told, yes, sir. I have seen the quarter. It will not cost much, maybe 15,000 to 20,000 rupees. I'll renovate and I'll stay. See, within a week, I was inside. So that was the love and respect. Then when I joined medical college, my teachers used to come to meet me because neurologist has come, our son has come. I'm a product of AMC, and AMC product has come as a DM. I think I was a second super specialist, if I don't recollect. Some another fellow from CTBS has already come and joined, or maybe even I may be the first one. So I was in that position. So the teacher used to come to congratulate me, to say me that, oh, yes, you have come. So now you have to start your work. And when the easy machine was started, physiology, anatomy, pharmacology, especially the paraclinical, used to come and say that, do my easy, let me see how my brain works, how my brain is doing, right? So that time I knew that it would show all the normal things, but still then they would like to see for themselves. And they will invite to their departments because the basic the neuro physiology, or when it is taught by a neurologist, I think that will be more related to the clinical problems and that will be more useful to them. Because when we want to learn something, we want to learn with an intention that what usefulness that particular learning has in your life. If you know that something is useful to your life, that means it is, if it has got any clinical association, probably that will be more beneficial and more interesting to learn. So that way, I used to take the classes in neurophysiology, in the Department of Physiology, and in the anatomy, yeah, about the neuroanatomy. Then that was once weekly or twice weekly. Then to the otorhinologists, to the ENT people about the vertigo, then the gynecological problems. I'll tell you an anecdote about when I was actually went for consultation to the gynecology obstetrics department. A lady who had paraparesis and both the legs were just flexed and the knee was touching their chest. So I examined and found that she is pregnant and pregnant in the third trimester of pregnancy. I was just astonished how she got pregnant. And simply I asked that if there is any surgical intervention that has to be done to the lady, if there was tumor or anything comes out, I must know whether the fetus inside is viable or not. That time I asked the question, क्या तुम्हारा बच्चा पेट में हिलता है? That lady, she couldn't reply, or rather didn't reply. she was asking to another one who was accompanying and asking, "Kaha kaha tha?" What he is asking, right? He told, "Where bacha ukhane khela tha." Then I realized that means, is the child playing inside? If I would have asked her, if your child is playing inside the womb, probably she would have replied yes or no. But if I say, if your child is moving or just thirsting inside, right? So to understand what it is. So I realized that even when you ask questions to women or to a patient, we must use the appropriate word. The fetus inside plays inside the womb, right? So that I learned in. And at that time, I had about 15 to 20 consultations a day. And I will be moving around psychiatry, medicine, surgery, because even neurosurgery cases I had to see. And I
Sir,
remember one professor was so humble and kind enough that on his emergency day, whenever any head injury patient or any rotating accident cases he used to come to my room and wait for me in the evening because we used to do rounds morning and evening both times. And he used to take me to with along with him to see those cases. I felt so honored and respected because a teacher, a professor of surgery is inviting me to see his cases.
so you are treating Ulfa insurgents also in between.
Ah.
Tell us about your association with Ulfa.
That is still that terror feeling comes to my mind. I didn't know who Ulfa is because from face they are same. You cannot recognize, right? But then they will come and a very soft language will tell that you have to move us. I didn't ask where. I didn't ask why because I knew asking those questions means just calling for a rest, right? So I used to go. Then I used to see patients. Most of them had infections, malaria. They stayed in jungle, right? So not much difficult. Give antimalarial, they'll be all right. And once they become all right, they think that he's a very good doctor. Because for them, treatment coming to the public and then get treatment was really difficult. So they used to take me to the hideout. At one moment, I can just confide upon you. I was taken to a hideout where I found somebody whom I thought is the supremo from his behavior and everything, with whom I had a meal after I saw him, right? And so generous. And later on, when I was caught by the CBI, taken for interrogation, the police guest house, and continuously for 3 days, right, 9 a.m. to 6, 7 p.m. in the evening, that time they told that you have treated this man with the chief of. I was just second. Ah, then he told, now you will be brought under TADA, you will be arrested under TADA. I could not
Oh,
help, right? But then one simple thing, one simple explanation that actually saved me, I told him that I did for a simple reason that I could not deny. Number one, as a doctor. And secondly, when I know, even if I know that they're like that, if I antagonize them, probably I will not be alive, right? And they told, why don't you take the help of the police? I told, police superintendent was killed just a week back. The SP was killed, was waylaid and killed. So whom should I go to? So after some time, they discussed something and then let me go. I am safe today. Otherwise, I would have been in jail. So that was like that. But then one thing was very interesting for me. And then I really appreciate that I did the right thing. I never asked their identity. Whenever I had to write a prescription, I simply asked, what name should I write? I didn't ask, what is your name? Because their names are changing. So simply I write the name and then give the prescription or the investigation. So that way I was safe.
wonderful, wonderful, sir.
They extorted me. They extorted me. Right? That time it was not a big sum, but I cannot just tell you what is the sum it was. But it was quite big for me. And later on, when I treated that particular big man, I told that, you see, people are taking help from me, your people, and I'm extorted. Later on, I learned that the money was refunded. Somebody came and gave back the money. But there was an interesting, the amount I paid, only 2/3 is me back. I thought that 1/3 was not deposited in their at, account. So the one who collected, actually, they also misappropriated.
So wonderful experience, just like Ekta Tiger. So you organized a lot of conferences. You
Yeah,
attended and Anycon 1995 2012 were the highlights, sir. Would
yeah.
you would you highlight some of those conference moments, especially with some of your wonderful colleagues, Dr. Amber Chakravarti? I'll show some photographs from these conferences.
Yeah, yeah.
Dr. Professor B.S. Das, the late
Yes,
Professor.
does.
Yeah.
Yeah.
Sir.
Yeah. So these are the conference photos. Actually, that time I had a hobby of taking photographs or
Right.
sharing photographs.
You're an avid photographer.
I'll not say that. I'll not like to claim my superiority. And this photograph is very important. This is Dibrugarh Neuro Club, as you
Right.
see. And
Yeah.
we celebrated the World Brain Day in 2015. So see,
Wonderful.
Dr. Mathai left us long time back, and that club was continuing. And at the time also, I was the president, and I happened to actually the make the con. Yeah, here all your Odisha colleagues are there.
Yes, sir. All
Yeah.
from Odisha.
Yeah,
Professor Sudhanshu Mishra, Professor
yeah.
Sanjeev Mishra, all of them are here.
Yeah. Professor Sudhanshu Mishra, I tell you, in 95, actually, he came to Dibrugarh as a postgraduate student. See,
Right.
on the day of conference or before that, he came to my house and told that we come for that. Then I arranged their accommodation in some guest house, and I am happy that I could help them even at the time. And till now, I have got a very good relation with Sudhanshu. He respects me like anything.
Right.
So that was, if you help somebody, he will never forget. But that help should be unconditional, not
Right.
conditional help. So that is how actually I am what I am today.
So we would also like to hear a lot about your family and your hobbies, sir. So I'll share a few photographs, and would you please highlight on Manju ma'am,
This is
your
a
wonderful daughters and sons?
family get together. You see, I am sitting here, and on my back is my wife, and next to me, the oldest lady is my mother.
Oh,
And
wonderful,
then
sir.
that young boy that you are seeing,
Yeah.
he is my son, Bhaskar. He is actually a computer scientist, and then he is
Oh,
doing well
wonderful.
in Guwahati. He settled
Right.
in Guwahati. Now he is married.
Right.
And the other two are my niece.
Oh, and in this photograph,
In this photograph, same thing. My wife, myself, my son, and my nieces. The on the other side, the behind is my oldest daughter, and just along with the son is her daughter. So this is also a family photograph taken at Bangalore. I think sometime in
very nice,
90s.
very nice, sir. Beautiful family. So you are a avid gardener. You have a hobby for gardening. This is one
This
of the
go.
beautiful
This
pictures.
should. This I am the director of that hobby, and real performer is my wife. You see this beautiful plant here. Really, people when they come for the in the morning for my the consultation, before I go to the room, the chamber, they will take photograph here, and they feel privileged that they had good photograph in the background. So this is actually my wife, who is very avid gardener, I'll say.
So
And
you
this is
grow a lot of medicinal plants.
medicinal plants and fruits. Pepe, you
Yeah.
have seen. Coconut, you have seen. Guava, you have seen. Yeah,
Right, right, right.
yeah.
And sir, you do a lot of boating and all.
Yeah, this is a picnic. This is a picnic scene. Yeah, we are doing because Dibrugarh is famous for the river cruise actually, because it is on the just on the bank of Dibrugarh is the river Brahmaputra. Every day we walk on
Right.
the river bank. We get fresh air and then the beautiful scenery. So that way, somehow we are healthy, I can say. And that's the beauty of Dibrugarh. Dibrugarh has got many beauties. I think I could, you have not shown one photograph where Satriya dance, fellow in white dress, I sent actually. Right, I was invited to one of the meetings in school. I think it was a prize distribution ceremony like that, and I was greeted by those peoples in the traditional way with lot of the musical instruments and their this thing. So that was really a good thing because in Assam there is a place called Majuli. In Majuli, still you can go to the place where you find people are living 400 years behind. It is not 400 years behind, not in the true sense of economic development, but in culturally they are living like that. That means Srimanta Sankardev's traditions are still followed, right? Those satras are still maintained. So that's a great place to see. And Assam has got another very beautiful things to see. The, the, the you can say hill stations of Assam are very, very beautiful. If you go to Haflong, then nearby to Arunachal Pradesh is one of the most uncharted sort of a place, right, for the natural beauty. Right? So if you go to Arunachal Pradesh from Dibrugarh, if you come sometimes, or I invite our members of the Neurology family, if you come, I think I can take you to those places and you will see that heaven on earth. Arunachal is heaven on earth. There are such places where you will not see, even in Switzerland or those countries which you can see here. Strays of ice.
Wonderful, sir.
In my view.
Sir, we learn you are a multilinguist. You know at least 5 or 6 languages, including English, Hindi, Assami, Bengali, and Nepali. Sir, that's
Yes.
wonderful.
I am born Nepali. My parents are Nepali. They were
Oh,
not, they were from Nepal long time back, about 5 or 6 generations. We
right.
stayed here. We adopted the culture and everything. But the language, when we speak inside, we speak Nepali. Of course, the Assamese words have cropped in. And then we studied right from whenever we go out of the house, we speak Assamese. Right? And all through my career, I was the topper in the Assamese language. Suppose
Oh,
even in a higher secondary, I had the highest mark in the university in Assamese. So that
right.
way, somehow, I had a knack for that. Then Sanskrit I learned my young age. Assamese, English I learned in my school and college days. And Bengali are my friends, the neighbors, Ambar Chakrabarti. I talk with him in Bengali, ki kochcha kemon acho, right? So that way I can speak, I can talk. Even sometimes I give lectures in those. And Hindi is a national language.
Right.
So that way,
Wonderful, wonderful, sir.
spontaneously this I have learned. And there was no formal training. And then I enjoyed being a multilingualist because that helps me wherever you go and whomever you meet to communicate without any hindrance. And language learning, I say, it's an art, it's a skill everybody should try to develop. Learning.
So you give a lot of lectures in nearby towns, teaching doctors, students, and you also do a lot of activities on AIR and Doordarshan, philanthropic activities also. So just highlight a little bit about them.
See, my passion is because I know I learned neurology very lately. People here do not know what neurology is. People, patients here do not know when to go to a neurologist with what problems. So for that, I started the series of lectures in schools, colleges, universities, everywhere. Actually, I was invited. Maybe they like me or they like my talk. They invited, and I used to talk on different subjects. And the aim ultimately will be to enlighten them what neurology is. And people have general misbelief that neurology is untreatable because even my teachers used to tell what subject you have learned. This I mentioned, you say that there is no treatment, multiple sclerosis, no treatment, motor neuron disease, no treatment, right? So I say, sir, why you are talking of that? Because neurology has got all the diseases from infections to trauma to injuries to neoplastic, all are there. You're just citing those degenerative diseases where till now we do not have a satisfactory treatment, but still the life can be more comfortable. To talk of the infections, right? Because you see, when I came to Dibrugarh in 1985, at that time, Dibrugarh was on the hotbed for Japanese encephalitis. So those cases I had to tackle, and I had to government sent me to different hospitals to just advise them how to manage the cases, because there were so many cases that even medical college could not accommodate everyone. So they have to be managed outside also, the district hospitals or the other community health centers. Then how to prevent. Then neurocyst sarcosis is another, because I found that in my the hospital campus itself, in the Fort Gate colony, the cleaners colony, there were about 20 or 30 patients with epilepsy, focal epilepsy, and later on there it was found they are all suffering from neurocyst sarcosis because they are Fort Gaters. They do have a very poor hygienic sense, and by teaching them now, of course, they are enlightened. At least the incidence has come down to a great extent. So those preventable neurology, actually, I stressed upon, because neurology, to a great extent, especially the communicable diseases, are preventable to a great extent, right? And then the
Wonderful.
another cap in my head is the treating of herpes simplex encephalitis. One professor of, I think, physics of the university where I was the advisor. And he suffered. One day he was brought to me in a state of altered consciousness. Till evening he was all right. At night he became a little confused. Next morning he was incontinent. He was incontinent, talking irrelevant. First he was seen by psychiatrist. Then he told that he has got fever, so it's something else. And I advised him admission. He got admitted in some private hospital. And at about, I saw him at around 7 or 8 in the morning. At 11, I found the patient is very serious to come immediately. So as he was professor of the university, so I had to run, and I found he was colic. That time I decided that it is not ordinary encephalitis. It is a very rapidly developing encephalopathy, which is herpes simplex, because there was no test done at that time, only blood count and other stuff. Didn't so much. But then clinically, he was put on massive dose of steroid, then mannitol, and later on with cycloprid. Only few vials were available on that day. So immediately it was called from Guwahati. Next morning we got the and in about a week's time, he became conscious. Until now, he is all right. And whenever he meets me, just says namaskar, because he's senior to me also. He says, I became the president of the uh, Assam Science Society because I am alive and it is for you. I told, I don't know that, but I treated you, that I know, and probably that treatment worked. So herpes simplex encephalitis, the most treatable neurological condition, have to be immediately identified. And even on your assumption, you have to start your treatment, because the steroid and menthol will do no wrong, no harm in a patient who is going. So that way, these are the pleasant moments of my life.
Thank you, sir. Thank you for touching so many lives and saving so many lives. As the time is short, actually, I could go on talking with you whole day. So, but we'll have one message from you for all the budding young neurologists, how they should touch their lives, how they should plan their careers.
It is a very difficult questions, because advise somebody is the most difficult thing. You do not know how to advise yourself or guide yourself. But still, then I'll say that if you want to come to neurology, be prepared with the dictum of Dr. Tandon, right? That you should try to learn the subject, live the subject, think about, dream about, and be totally involved in the subject, right? Not half-heartedly. Because if you come half-heartedly, probably you cannot do neurology or neurosurgery. If you get an emergency, you have to run. You cannot afford to walk. And the other thing is that it is very much rewarding, because when you become neurologist, you will enter a comfort zone. In the sense, comfort zone not for not doing works, comfort zone in the sense that everybody will be just regarding you with a special honor or respect, because they think that a neurologist has come, who knows the mind, who knows the brain, So he is a very knowledgeable person. So in all aspects of life, you have to behave appropriately. Second. And third is, see, being a neurologist, and when we have seen our the seniors and elders, how they behave, is we have to bring the torch to a higher level, we should carry the torch to a higher level about our clinical acumen, at the same time about our responsibility, our behavior, our attitude towards them. So that, and money, see, now a trend has come to go to the private hospitals and leave behind the medical college. I don't know. I sometimes feel hard because you see, when I passed DM examination, many of my friends they told, why you are going back to Dibrugarh? You go abroad. Because during 85, it was not so difficult. Why you are not going to other states? Right? Big hospitals, why you don't not join here? But I thought that as I was sent by the government, I must go back and repay my debt. I came here, right? I stayed here. And I believe that I have repaid the debt of my motherland, and I did the right thing. And for others also, I told them that I tell them that you became academic. When you become academic and you become successful academically, then you can go to the other fields, private fields, and you can sign over there. But initially, you must start your career in the teaching hospitals. And teaching should be a passion. It is not a simple profession. It should be a passion. You should like to teach the slightest opportunity. It is all the different skills you have to teach them. How you stand, how you walk, how you talk, how you behave, and how you deal with the problem. And then only probably you can go further. And clinical neurology, I tell you, is the most interesting thing. Clinical neurology will never go away. All the gadgets may come, different diagnostic tools might come, but then clinical neurology will remain forever. And that is the greatest satisfaction and pleasure if you can diagnose clinically and later on you probe with the investigations. That is your greatest success. And
Sir,
for those, yeah, please.
how do you like to be remembered, sir? How do you like to be remembered?
I like to be remembered as a person who loved his profession, who loved his colleagues, who loved his parents, his children, his family, and he loved himself. You see, one who loves himself, he can love his family. One who loves his family, he can love his neighbors. One who loves his neighbors, he can love his professional people. The first is love and respect, and it will automatically the what is called return you will get. And the second thing is that this was a man who loved everyone, even the patients, all their attendants, all the teachers, students, everyone. So love and respect should come, and that I did. And now I am getting the dividend that this is a sir who loved us in our young days. This is a sir who helped us in our young days, and we should never forget him. I think I like to remain not only in their brain, in their mind, I like to remain in their heart also. If I can remain in their heart, probably the greatest achievement of my life I had, I believe.
Thank you, sir, for not only giving us your wonderful and precious time, but also enlightening us on how you had your struggle, your perseverance, your achievements, and how you have affected the lives of so many people, saved so many lives. So we salute you for the clinician you are, for the neurologist, the philanthropist, and above all, the person, the human being that you are. The creativity of a person is simply not from the human brain, but creativity is from the mind, the ideas, and the dreams. So, we met today one of the stalwarts of neurology of Eastern India, Professor Dr. Narayan Upadhyaya, and heard about his life story. And I hope all of you loved it. And we personally thank Sir for giving us this wonderful opportunity. Thank you, sir. Thank
Thank
you very
you. Thank you. I must thank the organizers who have actually brought the concept of having this sort of activities recorded for the posterity. And uh, I must thank everyone, including you, And ultimately the IAM community, especially its president, who has actually made this possible for us to express our views and let people know that how we live, how we work, and how we fared in our life. Thank you very much. Thank you, Somadasan.
Thank
It's
you,
a
thank you,
pleasure to be interviewed by you. Thank you very much.
sir. Thank you, sir.